Hi, my name is Dori Clesis, and I'm with Mount Sinai Health System in New York. Today, we're discussing the partnership between the Bezos Family Foundation and Mount Sinai. So, joining me is Dr. Carrie Quinn, a pediatrician with Mount Sinai, as well as the executive director of the Mount Sinai Parenting uh, Center.
Yes.
Thank you.
Yep.
And we're also with Megan Wyatt. She's the managing director of programs and strategy for the Bezos Family Foundation. So, thank you for joining us. How did the partnership begin with the two organizations?
Well, the partnership started actually with the chief science officer at the Bezos Family Foundation, Ellen Galinsky, who is a colleague and friend of our developmental psychologist, Eliza Pressman, at the Parenting Center. And there was discussion about how can we integrate some of the science of early childhood development into pediatric training.
And then what sparked your interest there?
Well, I think we're just really fortunate to be able to surround ourselves with experts, the parents whose lives we want to touch, the children we want to impact, and then being able to work with experts like Dr. Quinn and her team to create new tools and new products that improve the lives of kids and families. And so it was really evident to us that they were the experts that we wanted to work with, because collaboration takes a lot of time and effort to do the transformational work that we know is needed.
Right. And we quickly realized that our missions were so aligned. The Bezos Family Foundation has so much work in getting the messages of the science of early childhood development out to parents and families and communities. And we had seen the work they'd done in museums and libraries of spreading this messaging. And our goal was really to get that messaging into the healthcare space. So we quickly realized, the healthcare space has such incredible access to families in the earliest years. 99% of families, have their baby in a hospital. There's countless well child visits, there's sick visits, ER visits. We have so many touch points with families in the earliest years. So we thought, how can we bring that science into the healthcare space?
And you actually have words and phrases on the wall that parents can actually read and react to.
Yes,
correct?
yep.
It's really interesting when we sought to answer the question, how do we share the science of early development with families? We actually met a firm called IDEO.org on the Aspen Institute campus. And what we learned is that parents are motivated to know the science, but overwhelmed. And so we need to figure out how to make it doable through programs like Mind in the Making and Vroom that share the science and build routines, leveraging the time that exists. And one thing that we learned in this work is that bricks and mortar, staircases, water fountains, hand sanitizers are all underutilized spaces and places to prompt an interaction that's joyful, that promotes development. And so that's how we began this journey with Vroom. We did environmental, but there was so much more to be done within the pediatric and healthcare space because of our own intuition, but also because of other research that showed that healthcare professionals are the number one trusted source of information on child development. We know that research shows that to be even more true. And so
Tell us about Vroom so you can explain it.
yeah, I'd love to. So Vroom is a vehicle that helps parents understand that brain building moments surround them. Changing diapers, preparing a meal, waiting. So much waiting when you're a parent. Those moments can be transformed if we show parents what to do and why it matters. And so it leads with a validating message that you have what it takes to be a brain builder, what you do well matters, and then through behavioral nudges on your phone in two different ways, mobile and SMS, through environmental integrations, through broadcast, those messages and tips are reinforced. But Vroom always starts with trusted relationships. You can't replace those. And as I say again and again, pediatricians have extraordinary reach and trust with families.
What has been the feedback? What has the feedback been like?
Well, so one of our big initiatives that we're working with the Bezos Family Foundation is this environmental transformation that you mentioned, and we have taken messages and created and drafted the words and the designs of what can go into different hospital settings. So we're doing 6 units across the hospital, starting in prenatal, labor and delivery, postpartum units, the NICU, the emergency room, and the regular general pediatric clinic. And we're taking those messages that room is based in, transforming them to the healthcare environment, and then they're going to be launched in July. So we're eager to see the response from both families that now will walk into this space that has messaging all around them that promotes the relationship they have with their child and early brain development. And so we're going to launch in July through the fall in each of those units and see not only how parents respond, but how the staff responds. We're going to be training everyone in those units to see how they can view their role slightly differently by infusing that science into the work they do with families. So anything from delivering a food tray to telling a new parent that they passed their hearing exam to changing their diaper or giving a bath to a newborn. How can that healthcare professional use that science to improve and promote brain development with their patients?
And I think what's been so amazing about this work, as we think about scale and impact at scale, I mean, we care a lot about the extraordinary numbers of kids in poverty in this country and how are we going to reach them all. Scale doesn't always mean just replication. It means adaptation. And so you have to take the tools that we've helped develop and change them so that they work to fit the opportunity. And you can't do transformational work and you can't do adaptation without partners that share a vision and alignment. And so I think that was really another aspect of this relationship that has made it so dynamic. And I think the tools that will come out of it really are poised to be useful to a lot of other clinics
So
in the
you're
country.
saying that the brain of a baby is a sponge, and that parents need to sort of interact with their child at all moments and use that to help them get
It's actually
strong,
interesting.
emotional.
The metaphor of sponge actually doesn't fully do its service. It's really that the brain is built for action, and that even before a baby is learning to talk, the language centers are lighting up and they're preparing. And so really understanding that baby brain is built for action, and as adults, our job is to continue to light that fire.
Right. And that is not one directional. It's this back and forth with the child, that it's, how a parent responds to a child's cues and their emotions and their conversation, and in that back and forth between the parent and child that really builds those brain connections.
So there's a lot of question and answer and engagement.
Yep, question and answer, but even when a baby can't speak, you're still responding back and forth to a simple cue. It might be a baby turning their head away or crying or arching their back. That's a signal. That's a sign of communication for an infant. So how can we help parents recognize those cues in the language of babies and then interplay and respond back and forth with them?
And training, you're working on a partnership together with a residency training program.
Yes, so we also have built a pediatric residency curriculum that really teaches the pediatric residents the science of early childhood development, why it's so important to a child's well-being, whether it's their physical health, mental health, their success in school, their success in relationships. We know that there are specific early parenting environment and behaviors that can promote a child's development. So how do we teach that to the pediatric resident? And how do we model for them what they can say and do in a visit to promote those parenting behaviors? So we've created an online, self-directed, free curriculum for residents and have piloted it at 8 sites across the country this past year, and are seeing amazing results with the residents. They're already showing improvements in their knowledge, in their confidence, and in their behaviors. And we're eager to get it out to all programs across the country. There are 210 residency programs across the country, training about 2,500 pediatric residents every year. And so how can we get that next generation of pediatricians to know the science and integrate it into the interactions they have with families?
Small goals.
Small minor goals.
Well, terrific
but
goals,
yes.
because the children are our future. So thank you so much for joining us.
Thank you.